Africa's vaccine rollout is getting a big boost from the World Bank. It's agreed to finance shots for hundreds of millions of people. The World Health Organization also plans to set up a technology hub in South Africa to help low-income countries produce their own coronavirus vaccines. These are the latest moves to help the continent where immunization rates have lagged even as cases rise. Paolo Montecillo has more.
For months, African countries have waited for vaccines from the COVAX initiative. The multilateral project aims to donate 2 billion doses to low-income nations this year. So far, fewer than 90 million have been delivered. So South Africa is stepping up to help the continent produce its own COVID-19 shots.
It's been shown now that we just cannot continue to rely on vaccines that are made outside of Africa because they never come, they never arrive on time, and people continue to die.
Africa's most industrialized economy is set to host a vaccine technology transfer hub with the help of the World Health Organization. It'll be made up of a consortium of drug firms and universities. They'll work to speed up the production of immunizations with mRNA technology, which is used in the shots made by Pfizer and Moderna.
The consortium involves a company called African Biologics and Vaccines, which will act as the hub both by manufacturing mRNA vaccines itself and by providing training to a second manufacturer called BioVac.
In that situation, we could even expect to see within 9 to 12 months vaccines being produced in Africa, in South Africa.
The WHO is negotiating with pharmaceutical firms, hoping they'll come on board to share their know-how. For its part, the World Bank has signed a deal with the African Union to pay for vaccinations for 400 million people. The money will come from the lender's $12 billion fund for the distribution of shots to poor members. That's over and above the doses from COVAX and will bolster efforts to reach herd immunity on the continent by next year. South Africa and India are also lobbying the World Trade Organization to waive vaccine patents in order to ramp up production globally.
And we would like the negotiations that are taking place there to proceed with speed because, as you correctly said, Dr. Tedros, people in Africa are facing a rising wave of infections.
The coronavirus outbreak in African countries is as severe today as it was at the beginning of the pandemic. The number of new cases per week has risen to its highest level in nearly a year due to more contagious variants. And just 1% of Africa's 1.3 billion people are fully vaccinated, meaning the crisis on the continent could still get much worse. Paolo Montecillo, TRT World.
For more, let's go to Amit Thakker. He's the president of the Africa Healthcare Federation and joins us from Nairobi. Welcome to the show. Now, over the past week, we've seen the number of cases double. Fatalities are up 20%. Is Africa headed towards a third peak in the pandemic?
It definitely looks like. The public health measures are now being tightened. We are extremely concerned about the rising cases, especially in 6, 7, 8 countries. Mind you that this is not happening across the continent. But you're right, we are concerned. And in majority of the African countries, the lid on the spread still remains very tight. It's the 7 countries, 8 countries that are setting the statistics of God.
Okay, now when we talk about building a plant that will manufacture vaccines in the continent, of course, that will take at least a few months. What sort of short-term responses are needed? Are there enough medicines, hospital beds, oxygen, medical experts?
So I think it's a double strategy that remains the same that Africa has been having. One is the public health measures of trying its best to have social distancing, washing hands, face masks, sanitization. And the second one is getting enough vaccines now. You've seen that we have less than 1% of our total population vaccinated, and that's purely simply because of supply. many African countries have now got enough infrastructure to get lots of vaccinations done. What we lack is the vaccines. So at the G7 and at all the international meetings, the call out is share doses now. That's what Africa needs. This double strategy before we start even thinking of producing our own vaccines.
It's probably very early to ask this question, but I'll put it out there. How long do you think it will be before at least most of the people in the continent are inoculated?
If by end of next year we get to 40, 50%, that would be great. I know that by September, the target was to get 10% of Africa covered. I can tell you 90% of the countries are going to miss that target. So by next year, at least more than 60, 70%, end of next year. So majority by end of next year or the year after is what I think is realistic. We might miss it by a year.
And once these doses are available, in terms of logistical challenges, how much of a hurdle do you think it is making sure getting those doses out to everybody who needs them?
It's incredible how fast African countries have learned that the whole logistics of vaccination needs to be in place. It's incredible how countries have responded. So not only double, in some countries triple the capacity. Take Kenya, for example, which could do 5,000, 10,000. It can easily now vaccinate up to 150,000, 200,000 a day. So I think Africa is ready, set to go. We need vaccines.
And very quickly, I want to get your views on the WHO, South Africa, India, other countries have been asking for temporary waivers on the intellectual property for vaccines. How critical do you think that is in the fight against the pandemic?
It's absolutely critical. I think it's a no-brainer. Anyone debating this doesn't realize that we are not safe until everyone is safe. So this waiver is one such step forward, not only for this pandemic, but it sends a structure and a culture of trying to keep humanity safe against pandemics like COVID-19 and such like outbreaks. So it's very important, that waiver.
Thank you very much, Amit Thakker there, joining us from Nairobi.